New research presented at the world's largest cancer conference highlights that scaling back treatment for certain cancers can make life easier for patients without compromising their outcomes. This shift represents a broader trend toward evaluating whether less intensive approaches, such as reduced surgery, chemotherapy, or radiation, can improve both the quality and longevity of patients' lives. The studies focused on ovarian and esophageal cancer, as well as Hodgkin lymphoma. Historically, cancer treatment protocols were characterized by aggressive interventions. For example, women with advanced breast cancer once endured massive doses of chemotherapy and bone marrow transplants, which proved no more effective than standard chemotherapy and resulted in significant patient suffering. This past emphasis on more aggressive treatment is now being reconsidered, prompting researchers to ask, do we need all the treatment that we have used in the past? The good news is that cancer treatment is not only becoming more effective, it's becoming easier to tolerate and associated with less short-term and long-term complications. Highlights from the American Society of Clinical Oncology conference in Chicago include findings from French researchers on advanced ovarian cancer. They discovered it is safe to avoid removing healthy-appearing lymph nodes during surgery. In a study of 379 patients, those who did not have their lymph nodes removed experienced fewer complications, such as the need for blood transfusions, with no difference in survival after 9 years compared to those who did have lymph nodes removed. Another study compared two treatment approaches for esophageal cancer, one involving chemotherapy and surgery, and another including radiation. After 3 years, 57% of patients receiving just chemotherapy and surgery were alive, compared to 51% of those who also received radiation. This study, funded by the German Research Foundation, suggests that the less intensive approach may be as effective. For advanced Hodgkin lymphoma, a comparison of two chemotherapy regimens found that the less intensive treatment was not only more effective but also caused fewer side effects. After 4 years, the less harsh regimen kept the disease in check in 94% of patients, compared to 91% for the more intense treatment. These findings suggest a promising shift toward more patient-friendly cancer treatments that do not compromise efficacy, potentially leading to a new standard in cancer care.